Welcome to today's deep dive into the complex anatomy of the temporomandibular joint, often referred to as the TMJ. This joint is essential for everything from chewing and speaking to subtle facial expressions, and its structure is much more intricate than it appears at first glance. Today I'll be breaking down each component of the TMJ, including bones, ligaments, and muscles, and in the next upcoming videos we'll take a close look at how they work together to allow such precise movements. Whether you're a student of anatomy, a dental profession, or simply just curious, you're in the right place. So let's explore what makes this joint both a marvel of nature engineering and a topic of ongoing research. Let's get started. Let's start by understanding the TMJ, or the temporomandibular joint, one of the most unique joints in the human body. Located just in front of each ear, the TMJ connects the mandible, I'm going to use the cursor right here, the mandible, or the lower jaw, to the temporal bone on either side of the skull. Unlike most joints, it has dual function. It can both hinge and glide, enabling a wide range of motions essential for chewing, speaking, and facial expressions. We actually have two TMJs, one on each side of the jaw, working together in synchrony. This joint is incredibly complex, with bony structure, cartilage, ligaments, and muscles all interacting to make movement smooth and controlled. Now let's dive into the anatomy of the mandible. As you look right here, the mandible is divided into a vertical section and a horizontal section. The body is the horizontal section that holds many critical landmarks. The ramus is the vertical section. Let's focus on the body right now. The alveolar process right here is the first that we're going to talk about, which runs on top of the mandible, houses all the teeth, and anchors them. Just below the premolar area, or the two premolars, we will get the mental foramen. This is an opening, allows the mental nerve and the blood vessels to pass through, supplying sensation to the chin and lower lip. The mental nerve is a terminal branch of the inferior alveolar nerve that passes within the body of the mandible, going out from the foramen, or entering, more correctly, entering from the mandibular foramen right here. At the midline, there is a mental symphysis, the fusion site that forms our chin, giving structures to our face. Alongside the inner surface, we will see the mylohyoid line, which provides an attachment for the mylohyoid muscle. It also separates the submandibular fossa from the sublingual fossa, defining spaces for different muscles and glands. Second off, we have the ramus of the mandible, which is the vertical section of the mandible. Starting off with the condylar process, which sits at the upper part where the mandible articulates with the temporal bone, which will form the TMJ, or the temporomandibular joint. Here, the condylar head, rounded upper portion, is covered with a fibrocartilage to ensure smooth articulation within the joint, but we will discuss about this later. Now, below the condyle, we will have, let's move here, we will have the neck of the condyle, which serves as a key leverage point for jaw movements. Each one has a medial and a lateral paw, which I will go into detail later, for the condyle to interact with the joint capsule, allowing smooth contact with the articular disc. Just anterior to the condyle process is the coronoid process, where powerful temporalis muscle attaches, aiding in jaw closure. Between those two processes lies the mandibular notch, a U-shaped dip, kind of right here. Moving on to the mandibular angle, where the body meets the ramus. This area varies in shape from person to person and serves as an attachment point for muscles like the masseter and the mediopterygoid, which is also very crucial for jaw movements. Moving from the angle to the mandibular foramen, which is located on the inner side of the ramus, the mandibular foramen is an entry point for the inferior alveolar nerve and vessels, which supply the sensations of the lower teeth. The nerve travels through the mandibular canal within the body and exiting, as I said earlier, at the mental foramen. There are a few more noteworthy structures I will be mentioning right here. First off, beginning with the lingula, near the mandibular foramen is where the sphenomandibular ligament attaches, and we'll talk about the sphenomandibular ligament later on. We will get also the submandibular fossa, a depression in the inner surface that houses the submandibular gland. Finally, the genial tubercle near the symphysis, which is located on the other side of the symphysis in the inner part, serves as the attachment points for the muscles like the genioglossus muscles and the geniohyoid. Each part of the mandible works together to support movement, stability, and function. And understanding those landmarks helps us to appreciate the complexity of the facial anatomy and the role of each part that plays in our daily lives. Now let's take a closer look at the anatomy of the condylar head of the mandible. The head of the condyle has a rounded oval shape, as you can see right here, that fits snugly into the glenoid fossa that I will talk about when we talk about the temporal bone. This structure acts as the main surface for the articulation, allowing smooth jaw movements. On top of that, we're going to have a cartilage layer. One of the unique features here is the cartilage, because unlike most joints that have hyaline cartilage, the condylar head here is covered with fibrocartilage. This layer of fibrocartilage is more resilient and well suited for the high levels of stress and diverse movements that is seen in jaw functions like chewing, talking, and grinding. Each condyle has a unique articular surface. The anterior surface is convex and divided further into anterior lateral and anterior medial, separated by a sagittal crest. This anterior shape is designed to interact smoothly with the glenoid fossa of the temporal bone. Now, in contrast, the posterior surface right here is flatter, providing stability within the joint. At either end of the condylar head, we have the medial pole and the lateral poles. These poles are distinct landmarks that provide stability and help guide the motion of the jaw within the joint itself. The alignment and the movement of these poles are critical for balanced, coordinated movements across the temporomandibular joint. Moving to the second bony part in the complex of the TMJ, we're discussing right now about the temporal bone. And as we can see, the temporal bone is highlighted in red right here, and it has a very close proximity to the TMJ. It's actually part of the TMJ. The temporal bone, just like the mandible, has many substructures that I'm going to discuss briefly right here. First off, we have the upper section, which is the squamous portion, which is thin and flat, that forms the side of the skull, and it is a very important landmark to provide an attachment point for the temporalis muscle. Extending forward right here, we can see the zygomatic process of the temporal bone, which is attached to the zygomatic bone. Together, they're going to create the zygomatic arch, which we say in our everyday life, the cheekbones. The second part is the tympanic part, which is situated just below the squamous region. This part forms the frontal and the lower walls of the external auditory canal, or the external acoustic meatus. This section guides the sound into the middle and the inner ear, making it essential for hearing. The third part right here is called the mastoid part, which is positioned posteriorly. The mastoid part is easy to recognize by the mastoid process, the bony prominence that is situated behind the ears. This section contains air cells that connect to the middle ear, playing a role in equalizing ear pressure. A very important muscle here attaches called the sternocleidomastoid muscle, which aids in head movements and rotation and flexion. The fourth part is the petrous part. The densiest pyramid-shaped portion of the bone houses the inner ear structures responsible for hearing and balance. Within this part are the cochlea for hearing and the semicircular canal for balance. It is also where to find the internal acoustic meatus, which provides passage for facial and the vestibulocochlear nerves. And now going to the most important landmark, the mandibular fossa or the glenoid fossa, within the squamous part of the temporal bone that articulates with the mandibular condyle. This connection forms the TMJ, enabling, as I said before, both hinge and gliding movements, which are very essential for jaw function. Also, I want to mention here the clinical relevance related to this bone. Understanding the temporal bone is very essential, as fractures in this area can affect hearing, facial nerve function, and balance. The mastoid process can be prone to infections such as mastoiditis, which, if goes untreated, can spread to the nearby structures. Moving now to the glenoid fossa of the temporal bone, which hosts the mandibular condyle right here. It is bordered anteriorly by the temporal eminence, very important structure that we will see later, posteriorly by the tympanic bone, which forms the anterior wall of the external auditory canal, internally by the sphenoid spine, externally, as we said, by the zygomatic bone. And finally, we can talk now about the TMJ as a whole complex. As we can see here, the TMJ is composed of two bony parts, the mandibular condyle and the glenoid fossa, along with the articular eminence, the discal apparatus, and the capsule that surrounds it, in addition to the muscles and the ligaments. An overview now, because we're going to go detailed later, that the disc here represents the intra-articular extension of the lateral pterygoid muscle. The inferior side of the TMJ complex corresponds to the condyle, and it is concave in both ways. The superior side corresponds to the fossa and is posteriorly convex and anteriorly slightly concave. The disc inserts itself through expansions or wings on the medial and the lateral tubercles of the condyle that we discussed and mentioned before, and also on the posterior side of the condylar head. It reaches all the way down to the neck. The condyle and the disc apparatus together constitute an inseparable anatomical and physiological complex, which we will call the condyle disc complex. This complex is intimately connected to the superior head of the lateral pterygoid muscle, the superior head of the lateral pterygoid muscle, along with the posterior fibers of the temporal muscle and the deep fibers of the masseter muscle. They create a muscular apparatus called the tensor apparatus, completing the condylar disc muscle complex. And as I said, I will explain much more in detail later this video. Now, the TMJ, just like any other body part, needs innervation, vascularization, and nutrition. The most innervation is provided by the auricular temporal nerve as it leaves the mandibular canal behind the joint and ascends laterally and superior to wrap around the posterior region of the joint. Additional innervation is provided by the deep temporal and the mesenteric nerves. When it comes to vascularization, it is represented as a complex arterial vascularization provided by the branches of the external carotid artery, principally the superficial temporal branch. Other contributing branches include the deep auricular, the ascending pharyngeal, and the maxillary artery. And in this case, the nutrition comes from the synovial fluid located in this joint. Diving even deeper to the TMJ, the discal apparatus is a very important structure that is to be discussed. The apparatus, when looked anterior-posteriorly, consists of three parts: the anterior, the intermediate, and the posterior. But that's lame. Anatomy doesn't like to call it like that, so we have different names for it. The first part, the anterior part, is called the tendinous prediscal lamina. The second part, the intermediate part, is called the disc itself. The posterior part, the third part, is called the retrodiscal area. Now the names make sense. The tendinous comes from a tendon, meaning there is a muscle insertion, and as we said before, the superior head of the lateral pterygoid muscle has fibers that directly continue within the disc, hence tendinous. Prediscal, the prefix pre always says anterior. Discal is the disc itself. Prediscal meaning that this section of the anterior portion is located anterior to the disc itself. Lamina, because we have one lamina, unlike the posterior, we have one bilamina. The prediscal part of the joint is located on the anterior portion of the condyle, and as we said before, the condyle is divided into an anterior medial portion and anterior lateral portion. The TMJ then receives two divergent muscle insertions, mainly anterior medially, which is a single insertion, and horizontal, consists of the fibers of the superior head of the lateral pterygoid muscle. And on the anterolateral insertion, we have double and vertical insertions consists of fibers of the posterior head of the temporal muscle and the deep head of the masseter. Thus, the dynamic prediscal protecting system of the TMJ is created, and we call it the tensor apparatus. So again, the tensor apparatus combines the following three muscles: the superior head of the lateral pterygoid muscle, the posterior fibers of the temporal muscle, and the deep head of the masseter muscle. Moving to the disc itself, the intermediate part of the disc. The disc itself has the shape of a thin, inextensible fibroconnective lens. It is avascular and it's not innervated. And any discal lesion will be here irreversible. Very important to know. It consists of further three divisions. The anterior-inferior part, 2 mm thick, located on the tip or slightly behind the most inferior part of the articular tubercle or eminence. A posterior superior part, which is 3 mm thick, located on the highest part of the condyle, and an intermediate part or area, which is 1 mm thick, naturally centered between the two bony articular surfaces. This area is often the subject of wear and perforations. In the posterior part of the intermediate part of the disc sends extensions and wings towards the medial and the lateral tubercles of the condyle. If one wing is lost, the disc will be pulled in the opposite direction of the tensor apparatus. The last and the final section of the discal apparatus is the bilaminar retrodiscal area. Again, the name makes sense. Bilamina, retro, the prefix retro, meaning posterior, discal is the disc, area is located right here. The bilaminar retrodiscal area consists of the common lamina, right here, and two independent ones, a superior one and then an inferior one. The common lamina is 5 mm long, has been thought to be the disc itself for a very long time. It is the area where wear also occurs, especially on the lateral side. The inferior lamina is a collagenic in nature, represents the terminal portion of the tendon of the lateral pterygoid muscle, and is inserted on the posterior side of the condylar neck, where it unites with the periosteum of the neck at relatively low level, 10 millimeters. This lamina represents a real Achilles tendon of the joint because it can be the location where tendinitis would occur, as well as this insertion and stretching, which can cause discal displacement and dysfunction that we will discuss also in other videos. The superior lamina is thick, well vascularized, elastic, and has a recoil effect, which therefore encourages the disc to return. Another very important thing that we didn't talk about is this section right here, the area that is between the two laminas. There's a triangular space called the interlaminar area, which is filled with loose tissue and a network of veins that are known as the Zinker's pillow. This structure acts like a hydraulic dumper. It fills with blood when you open your mouth and empties when you close it. This zone is actually highly innervated, and it can be a source of pain if there's high pressure exerted on it. So injuries in this area may lead to joint dysfunction or even arthrosis. The fibrous capsule of the TMJ acts as a supportive collar, primarily composed of collagen. It attaches broadly around the joint, kind of encapsulating it, and the condylar neck as well, which is firmly connected also to the articular disc itself. It creates two compartments within the disc. The upper compartment right here, which is called the suprameniscal, which allows gliding or translation movement, whereas the lower compartment, the submeniscal, enables rotational movements. Those movements are very important when we open and close our mouths, as well as other functional movements, but we will discuss in a different video about opening and closing of the mouth, where those two compartments actually are activated. This capsule, well supplied with blood vessels and nerves, has synovial membrane. This membrane produces synovial fluid for lubrication. The articular ligaments spread from the base of the skull to the condylar neck. They harden the medial and the lateral sides of the capsule. The lateral ligament is inserted upwards on the anterior zygomatic cervical and in the lateral margin of the glenoid fossa, and downwards on the condylar neck. It does not intervene as a stabilizer of the joint, a role that belongs to the muscles, but as a proprioceptive site that is supposed to control the joint movements. It passively participates in the downward and backward movements. Its tensioning will transform the rotation movement into a gliding one. The medial ligament is thinner. It is less resistant than the lateral one. It is inserted upward on the base of the lateral spine of the sphenoid bone and downwards on the condylar neck as well. After discussing the articular ligaments of the TMJ, namely the lateral and the medial ligament, we're going to mention briefly the extra articular ligaments of the TMJ. Temporomandibular ligament, the sphenomandibular ligament, and the stylomandibular ligament. Those three ligaments have an important role in stabilizing the joint. So, a summary of the TMJ apparatus: we have bony parts, discal part, muscles, ligaments, and capsule. Bony, two bony components, the temporal and the mandible. Disc, we have three parts of the disc: the prediscal lamina, the disc itself, and the bilaminar retrodiscal. Muscles, the tensor apparatus, that are inserted on the anterior portion of the prediscal lamina. Ligaments, we have articular ligaments located within or around the joint, and extra articular ligaments that are located around to support the TMJ. And the capsule, which separates two compartments, the suprameniscal and the submeniscal, that are involved in different type of functional movements and also provides synovial fluid of the joint for lubrication and nutrition. Thank you so much for watching this video on the detailed anatomy of the TMJ. I hope you found it informative and engaging. If you have any questions or thoughts, feel free to just leave them in the comments below. And stay tuned for more in-depth explorations of the TMJ and other fascinating topics. In the upcoming video, we will dive deep into the mechanics of this joint, so namely like opening and closing of the mouth. Stay tuned and see you in the next one.